Now, before we begin today's announcement, I want to take a moment to address the heartbreaking and deeply tragic events that occurred at Emmanuel AME Church in Charleston, South Carolina last evening. This is a crime that has reached into the heart of that community. The Department of Justice has opened a hate crime investigation into this shooting incident. The FBI, ATF, U.S. Marshals Service, Civil Rights Division, and the U.S. Attorney's Office are working closely with our state and local partners, and we stand ready to offer every resource, every means, and every tool that we possess in order to locate and to apprehend the perpetrator of this barbaric crime. Acts like this one have no place in our country and no place in a civilized society. And I want to be clear, the individual who committed these acts will be found and will face justice. And as we move forward in this matter, my thoughts and prayers, and those of our entire law enforcement community here at the Department of Justice and around the country, are with the families and loved ones of the victims in Charleston. Even as we struggle to comprehend this heartbreaking event, I want everyone in Charleston and everyone who has been affected by this tragedy to know that we will do everything in our power to help heal this community and make it whole again. I encourage the people of Charleston, South Carolina, and the wider area to continue circulating the photos of the alleged perpetrator and report any tip, no matter how small, no matter how minor, to the tip line, which can be reached at 1-800-CALL-FBI. Thank you. And now, today's announcement. Today, I am joined by Secretary Sylvia Burwell from the Department of Health and Human Services, Director Jim Comey of the FBI, Assistant Attorney General Leslie Caldwell of the Justice Department's Criminal Division, Inspector General Dan Levinson of the HHS Office of Inspector General, and Deputy Administrator and Director Dr. Shantanu Agrawal of the Centers for Medicare and Medicaid Services. We are here today to announce a major advance in the federal government's fight against fraud in our nation's healthcare system. Over the last 3 days, as part of a coordinated nationwide takedown, the Medicare Fraud Strike Force, a joint initiative of the Departments of Justice and Health and Human Services, comprising federal, state, and local investigators and law enforcement officials from across the country, joined with 7 additional U.S. attorneys' offices in charging or unveiling charges against 243 defendants in 17 federal districts for their alleged participation in Medicare fraud schemes involving approximately $712 million. This is the largest takedown in the strike force's 8-year history. It is the largest criminal health care fraud takedown in the history of the Department of Justice, and it adds to an already remarkable record of enforcement. The defendants charged over these last few days include doctors, patient recruiters, home health care providers, pharmacy owners, and others. They are accused of an array of serious crimes ranging from conspiracy to commit health care fraud, to wire fraud, to money laundering. They billed for equipment that wasn't provided, for care that wasn't needed, and for services that were not rendered. In one of the more egregious allegations of exploitation of both the Medicare system and vulnerable patients, the owners of a mental health facility in Miami billed for intensive psychotherapy sessions that resulted in tens of millions of dollars in reimbursements for the doctors, based on treatment that was nothing more than moving patients to different locations. Several of these patients suffered from illnesses like Alzheimer's and dementia and were unable even to communicate with their supposed caregivers or therapists. Further, nearly 50 of the defendants in this takedown are charged with fraud relating to the Medicare prescription drug benefit program known as Part D, which is the fastest growing component of the Medicare program overall. One owner of a healthcare provider in the Southern District of Florida received $1.6 million from Medicare Part D for prescription drugs the provider never purchased and certainly never dispensed. Another defendant, a doctor in the Eastern District of Michigan, is alleged to have prescribed unnecessary narcotic pain medications to patients in exchange for the use of their identification information to generate false billings. Patients who attempted to withdraw from the scheme were threatened with a loss of access to their prescription narcotics. Having deepened these patients' addiction, the doctors then used that addiction to keep patients bound to their scheme. Now, taken in total, today's action represents the first large-scale effort to focus on Medicare Part D fraud and demonstrates an expanded federal focus on this important issue. Now, the charges that we are announcing today are the culmination of a truly national effort involving approximately 900 law enforcement personnel acting in concert to execute a set of highly complex and highly coordinated law enforcement activities stretching across the country from Florida to Alaska. This takedown, like those before it, would not have been possible without the key partnerships forged by the strike force over the last 8 years among federal, state, and local officials, and the cooperation spurred by the joint initiative known as the Healthcare Fraud Prevention and Enforcement Action Team, or HEAT, that was launched by DOJ and HHS in 2009. As a result of strike force operations since 2007, we have filed charges against more than 2,300 individuals, accounting for over $7 billion in Medicare losses. This is a crucial part of the Department of Justice healthcare fraud enforcement efforts, which include the recovery of a total of $15.3 billion through False Claims Act cases in cases involving fraud against federal healthcare programs since 2009. Now, these are truly extraordinary figures, and they reflect our administration-wide commitment to safeguard precious public resources, to rid our healthcare systems of fraud and abuse, and to sustain the integrity of programs that are essential to the public welfare. In the days ahead, we will continue our focus on preventing wrongdoing and prosecuting those whose criminal activity drives up medical costs and jeopardizes a system that our citizens trust with their lives. The Department of Justice is prepared, and I am personally determined to continue working with our federal, state, and local partners to bring about the vital progress that all Americans deserve. Now, I want to thank all of the law enforcement officials who were part of the team that made this sweeping takedown possible. Their tireless efforts enabled us to move quickly and aggressively, and their inspiring collaboration will be a model for us going forward. Now, at this time, I'd like to turn the podium over to Secretary Sylvia Burwell, who's been a dedicated leader and a truly indispensable partner in this important work, and who will provide additional details on today's announcement. Thank you so much, and now Secretary Burwell.
Thank you, Attorney General Lynch, and thanks to everyone for being here today. Medicare is the cornerstone of the social compact that we have with our citizens, and there is no greater responsibility than ensuring its integrity. That's why eliminating fraud, waste, and abuse is a top priority for the administration and the Department of Health and Human Services. We are deeply committed to protecting the Medicare and Medicaid programs and will not tolerate theft from taxpayers. Today's development is a victory for those taxpayers and each of us who will depend on the stability of Medicare in the years to come. As Attorney General Lynch mentioned, this is the largest arrest in the strike force's history, both in terms of the number of individuals as well as the dollar amounts. The investigation stretched across the nation. In fact, this is the first action we've taken to pursue cases in non-strike force districts. This followed the data, we followed it where it led, and it exposed more than 240 suspects, and specifically we targeted Medicare Part D. And as we identified allegations of fraud like these today, the Affordable Care Act increased Medicare's flexibility to suspend payments to providers pending investigations. And we are using that authority today, stopping payments to certain individuals and entities that are associated with these cases. Through excellent investigative work, which included data analytics combined with real-time field intelligence, as well as meticulous planning and strategic execution, this team has made real gains in our ongoing fight against fraud. These arrests add to the approximately 2,300 people charged as a result of these operations, and the strike force has a conviction rate of 95%. These efforts, enhanced by the Affordable Care Act, add to the hundreds of millions we have saved through fraud prevention since the law was passed. with new tools like enhanced screening and enrollment requirements, tough new rules and sentences for criminals, and advanced predictive modeling. We have managed to better find and fight fraud, as well as stop it before it starts. This administration is committed to working across agencies to better serve our taxpayers. And fighting fraud is a key part of our efforts to build a healthcare system that delivers better care, spends our dollars more wisely, and puts empowered, educated, and engaged consumers at its center. I applaud the work of the strike force. With their help, we will continue to be diligent in our fight against waste, fraud, and abuse, and in protecting the integrity of these programs. Let today's events be a message to others across the nation. We will not stop here. We will work tirelessly to prevent these programs from becoming targets and fight fraud wherever we find it. That is how we will keep Medicare accountable, reliable, and strong. And now I'm happy to introduce my colleague, FBI Director Jim Comey.
Great. Thank you, Sylvia. Turn that just a little. Good morning. Can you hear me okay? Great. I want to join the Attorney General and Secretary Burwell in thanking the folks who did the hard work to make these cases possible. I especially want to thank the men and women of the FBI. It is their toil and their tenacity that makes possible the work that I get to stand here and talk about in Washington. That work every day across this country makes an enormous difference for incredibly vulnerable populations. As both the Attorney General and Secretary Burwell noted, healthcare fraud is an enormous problem in this country. Healthcare spending is 1/6 of our economy. Those of you who follow criminal work know that if you want to find criminals, you follow the money. There is a lot of money there, and so we find a lot of crime there. We have over 2,700 open healthcare fraud cases across the country because that's where the money is. In these cases, we followed the money and found criminals who were attracted to doctors' offices, to clinics, to hospitals, to nursing homes in search of what they viewed as an ATM that was a freebie to them but is actually filled with taxpayers' money. We see these cases running the gamut from corporate fraud type cases to enterprise type cases to one-off rip-offs. These crimes take money directly away from vulnerable populations, people who need this care, old folks, poor folks, people with disabilities. There are no victimless crimes when it comes to healthcare fraud. These offenses harm every single person who pays for their healthcare premiums. It harms every business that supports healthcare for their employees. It harms every single taxpayer in the United States. $1 stolen from our healthcare programs is $1 too many. So how do we make these cases? We make them using the tools that we use in our most sophisticated endeavors. We use intelligence to try and understand, so what are the trends? Where are the bad guys going next so we can get there before they get there? We use technology to collect and analyze and share huge amounts of electronic information. We use forensic accounting and analysts, extraordinarily smart and talented people, to plow through this information to decipher it. We use rapid response teams to surge to where the bad guys are going. And we use our bread and butter investigative techniques, wiretaps, undercovers, sources, interviews, surveillance, all the stuff we do to make our most difficult cases. And last, we rely upon effective partnerships. We do nothing alone, especially when it comes to battling healthcare fraud. The partnerships we have forged, especially with the HHS Inspector General, are vital to this effort. We need help, though, in a different way. We need help from the public. We are doing lots of hard work every day, but there are things that the good folks of this country can do for us, and actually I'll name 3. The first thing is, if you see something that seems weird to you, or too good to be true, freebies or benefits or prizes or gifts in connection with healthcare, tell us. Right? If it feels too good to be true, it is almost always too good to be true. Please let us know when you see such a thing. Second, read those forms that come in the mail, your explanation of benefits. I know they seem boring, and I hope they're boring, but they may contain indications that something is going on that we ought to check out. And last, protect your benefit cards, protect your ID numbers as you would protect the vital parts of your identity. If you see something that makes you feel strange, that makes you think something might be going on, call the FBI or call the HHS Inspector General. You're not going to get somebody in trouble unless there is trouble. right? We investigate things all day, every day, and some of them turn out not to be something, and nobody is harmed. But if you don't tell us about it, we can't check it out. So working together, we are going to continue to try to find where the bad guys are going and send a very, very powerful message that there are significant costs in jail time to this kind of conduct so we can change behavior. With that, I'd like to introduce my colleague, Leslie Caldwell, Assistant Attorney General in charge of the Criminal Division.
Thank you, Director Comey. Today's takedown is really a prime example of 21st century data-driven policing. Every day, the Criminal Division grows more strategic in our approach to healthcare fraud, to prosecuting Medicare fraud. We're analyzing billing data in real time, working with our colleagues at HHS. We're targeting hotspots around the country where the data shows that Medicare fraud is pervasive, and we are focusing on the types of healthcare services where the data is showing there's a high potential for abuse. We're also using the data and other techniques that we've learned over the years to speed up our investigations. And by doing this, we're increasingly able to stop these schemes at the developmental stage before they grow, before they spread, and before they move to other parts of the country. And we're focusing in particular on medical professionals, specifically doctors, but also other medical professionals. And so far in today's takedown, 19 doctors have been arrested and a total of 44 medical professionals. This approach that we're taking has led to great results like the ones we're seeing today. I also want to just note that our approach to healthcare fraud, working with our colleagues at HHS and our colleagues in the Civil Division, is really more than paying for itself. During the period from 2012 to 2014, the average return on investment for the Healthcare Fraud Abuse and Control Act program was nearly $8 for every dollar that we spent. So in other words, the American public is getting an almost 800% return on its investment in our efforts against Medicare fraud. And that includes only the money that we've actually recovered. It doesn't include the decrease in payments that's very significant as a result of the deterrent effect of our efforts. So I want to thank the Criminal Division lawyers and other employees. I want to thank the U.S. Attorney's offices around the country who assisted in the effort, the FBI, HHS, and our many state and local partners on this very successful takedown. And I'd like to turn things over to my colleague, Dan Levinson, the Inspector General of HHS OIG.
Thank you, Leslie, and good morning. As you've heard, today's action marks the nation's largest criminal healthcare fraud takedown effort in history. This week, the Office of Inspector General deployed more than 300 special agents and forensic specialists, alongside hundreds of other law enforcement personnel, to execute arrest and search warrants across the country. I want to extend my deepest gratitude to these individuals, particularly our nation's law enforcement personnel, who worked unstintingly over many months to achieve this unprecedented action. The Medicare and Medicaid programs are critical to the health of millions of Americans. Those arrested today are suspected of defrauding these programs of more than $700 million, thereby placing greed above patient care. While this operation is almost twice the size of previous takedowns, it does not solve the problem of healthcare fraud. We all have more work to do. For its part in this effort, OIG has focused on and will continue to focus on fraud in Medicare prescription drugs, Medicare home health services, and Medicaid personal care services. Fraud in these three areas is especially damaging and undermines our healthcare system. Of particular note is fraud in Medicare Part D, in which costs have risen 136% since 2006 to $121 billion last year. Our focus on Medicare Part D continues because more than 41 million Americans depend upon that program, and its integrity must be protected. Investigating and arresting those who threaten the health of our most vulnerable citizens is a top priority for OIG. Today's efforts represent our commitment to protecting beneficiaries and the vital healthcare programs upon which they rely. Thank you, and I'd now like to turn the conference over to Shantanu Agrawal of the Centers for Medicare and Medicaid Services.
Thank you, IG Levinson. The collaboration between the Strike Force and the Centers for Medicare and Medicaid Services is having a real impact on protecting Medicare and Medicaid beneficiaries and preserving these programs. Since 2009, there has been a dramatic decline in both durable medical equipment and home health spending by Medicare, areas of significant focus for both CMS and its law enforcement partners, and a national decline in spending on community mental health centers. The strike force has charged thousands of defendants for millions in fraudulent billings, and CMS has changed its policies to limit incentives for gaming in this area. The cases and charges announced today are significant. Such inappropriate treatment can inflict real harm on patients, including those that have endured the risks and trauma of unnecessary treatment and services. This makes our shift to prevention a critical task that has been strengthened by the Affordable Care Act, and CMS is working to keep bad actors out of the program. CMS has paused provider enrollment in high-risk areas of the country, including 5 of the heat strike force cities. This pause allows CMS to work with law enforcement on actions such as these to clean up the base of existing providers. We are also working to suspend Medicare payments to providers pending investigations today by stopping payments to certain individuals associated with the cases announced here. Finally, CMS is using risk-based screening, advanced analytic technology, and data sharing with state and private partners to root out ineligible providers in federal programs. These efforts have resulted in the removal of nearly 575,000 enrollments since passage of the Affordable Care Act, and CMS is developing additional safeguards such as expanding provider oversight to the Part D program to continue to strengthen the Medicare program in the future. CMS will continue to work with our law enforcement colleagues, states, and other plans to safeguard patients and the integrity of our programs. Thank you.
Thank you, Dr. Burwell. Thank you all. Any questions?
Attorney General, I'm sorry to go off topic at the beginning, but has there been a change in the status of the search? You were both notified of something while you were on stage. I'm just curious if there's been any change in the status of the search in South Carolina.
I can confirm that there is a subject in custody in relation to the shootings in Charleston from last evening. And of course, this moves us into a different phase of the investigation, which will be pursued as vigorously and with as complete cooperation as the apprehension of this individual.
What is it about the facts of this case that prompted you to open a hate crime investigation so quickly?
With respect to the hate crime investigation, I'm not going to go into the specifics of it, particularly since we do have someone in custody. We want to make sure to preserve the integrity of the investigation. But certainly some of the elements that came out that were reported to us led us to conclude that that was a possibility. So we opened it as a hate crimes investigation. Now that we do have someone in custody, we will be exploring all the motives that might have been in play there.
Will this be prosecuted by the state?
You know, when we have a case like this, we look at where the facts take us. Certainly this is an egregious crime. Certainly this is a homicide investigation, and we understand that there are families who are grieving incredibly for the loss of their loved ones. But again, we will now be looking at all of the facts, all of the motivations, all of the things that led this individual, if he is in fact the shooter, to commit this crime, and we will determine which are the best ways in which to prosecute the case.
Well, since the state can pursue the death penalty, what would be the factors that would lead you to have it be a federal prosecution?
You know, at this point, it's really premature to determine which is the best venue, either state or federal, to pursue this matter. First, we must confirm that this individual is involved in it. We must confirm the nature of his involvement. We must confirm his motivations, his intentions. So it's really premature at this point to say what would determine that. We do look at a number of factors.
Can I ask a question to Director Comey, please, if that's possible? First of all, great graduation speech that you gave the other day. It was very inspiring. And so this is not really an example of effective communication, but I have a multi-part question on the same topic. Is there anything that you can tell us that you've learned about the motivation of this individual, where he obtained a firearm, whether there was any threat to the church ahead of time, and whether there have been any threats to any other churches? Anything at all that you can tell us on those points?
I'm not going to walk all the way over there to give you a non-answer. I'll let the boss give you the same.
Now, we're not going to be discussing details of the investigation at this time. Certainly, and as I mentioned before, now that we do have someone in custody, we will be conducting as full and as thorough an investigation arising out of that circumstance, building on the cooperative work that we have with our state and local partners in South Carolina.
Director Comey, on related topic, is there any guidance that you're giving field offices in terms of outreach to faith communities after this?
As a result of the shooting last night?
Yeah.
The answer is not yet.
But you will.
Well, I'm sure the Attorney General can answer this one better than I can as well. It's something we think about and do quite often.
Well, I can say that with respect to this particular case, as with all cases that involve a faith-based institution, be they a church or a mosque, we do have outreach efforts. We do coordinate at the local level to reach out to members of the faith-based community who may be either directly affected by this or certainly would have concerns about a matter like this. The type and nature of that outreach would depend upon the nature of the case or the crime, and also where people are located. But certainly there is outreach going on that will continue. I can also let you know that the Department of Justice's Civil Rights Division is on the ground in Charleston, and the Community Relations Service, or our CRS division, is also on the ground in Charleston, and they work with all aspects of the community when there's been an event like this.
Do you have any plans to do that?
Attorney General, could you provide us an update on your investigation into a hack of OPM by the Chinese?
At this point, that still is a matter also under active investigation, so I'm not able to provide any specifics about that. I'm sorry.
Director Comey, as long as we're off the topic here, may I ask you about a different concern these days, and that's this increasing number of arrests we're seeing in ISIS cases. And it does appear that a lot of these cases are ISIS inspired by social media. Do you feel that you have the capability to monitor all the communications you need to, or is a lot of this happening in a space you can't go, or you can't go?
I'm going to stay away from this mic. I'm too tall for it, Pete. We do not have the capability that we need in this respect. ISIL has spent about a year investing in trying to reach troubled minds in the United States through social media, to either recruit them to come to their so-called caliphate to fight or to kill where they stand. Increasingly, over the last year, they have moved those troubled minds to end-to-end mobile apps that are encrypted end-to-end, and so they are dark to us. So our job is to find needles in a nationwide haystack, needles that are increasingly invisible to us because of end-to-end encryption. This is the going dark problem in high definition, right? This is what we've been talking about, that increasingly there are significant public safety aspects to the universal strong encryption that we encounter in criminal cases and in national security cases. There's lots of important issues at stake here. Privacy is something we all care a lot about, but this is in living high def, the going dark problem merging with our counterterrorism problem. And so we work every single day to try and find other ways to find those invisible needles, but I do not have all the tools I need because of that encryption.
What's the solution?
I think the solution is complicated, and I can't stand here and tell you clearly what it is. There's a lot of work going on that the President has directed to try and develop solutions that will surely involve consideration of legislation, regulation, cooperation. The companies that are providing communication services don't want folks killed by people using their platforms, so we're having good conversations with them. I'm sure a big part of it's going to be international cooperation. It is a really, really hard problem, but the collision that's going on between important privacy concerns and public safety is significant enough that we have to figure out a way to solve it.
There are a number of racially motivated cases being looked at by your Civil Rights Division. Is there something larger going on in this country in terms of race relations, in your opinion?
Well, I can't speculate as to the motivations behind every single case, and certainly we would want to take a look at that and see whether or not we're seeing any patterns or trends. We do take every issue very seriously. We take every incident very seriously, and we investigate it to the fullest extent of the law. We also do that in great cooperation and collaboration with our local counterparts. As has been pointed out, sometimes state or local charges might fit a case more appropriately than federal civil rights charges. Sometimes the federal civil rights charges are in fact the appropriate ones to bring. So we're finding that every case is really unique, and so we're moving along those lines.
Will you be going to South Carolina yourself to visit the community there?
You know, I don't know at this point. We certainly will be reaching out to that community. And as I indicated earlier, there's already a strong connection there. We have our local U.S. Attorney's Office very much involved in this matter, as well as state, local, and our Civil Rights Division and our Community Relations Services will be there on the ground. But this certainly is just it is an unspeakable tragedy. It is a tremendous loss of life. It is a tremendous loss to the community. It's a tremendous loss to the faith community. I believe the pastor was one of the individuals whose life was taken in this event, and so we will be looking to provide every support that we can.
Secretary Burwell, question. Secretary Burwell, how about a healthcare question here? Are you satisfied that that you've done all you can, the government has done all it can to make this crime more difficult to carry out? Is it too easy to commit healthcare fraud?
So I would start with, we've engaged and are using more and more tools. We talked a little bit about those tools, and we were given authorities as part of the Affordable Care Act that help us with some of those tools. Some of those tools that we have now that we didn't have before that are very helpful are things like the fact that today we are starting to use the tools that for a broader group we stop payment. Another one of those tools that I think is very important is we now do checking at the front end. For anyone who reaches a certain threshold before you can come in and be a registered person to be or provider to get Medicare payments, you may have to pass through certain other tests in terms of making sure you're able to provide. The other thing that we're doing are the data and analytics that have been mentioned, but to explain what that means is, and that's moving from a pay and chase model to a prevention model. And that's a model where what we're able to do is take those data and analytics, and when we see things that aren't consistent with a normal pattern, we can go at them. The final thing that's an important thing that we're doing now that we haven't done as much before is the information sharing. And that's across all the parties and players here, but it's also with states. So when providers have committed Medicare fraud, we are now getting that information to the states to prevent those providers from serving in Medicaid, because the states run those programs. With all that said, we can and always will try to do better. So I think we have new tools. We're using them aggressively, but want to use them more.
And are you confident you have all the tools you need to respond to a Supreme Court decision on the Affordable Care Act, no matter which way it goes?
So with regard to the King versus Burwell case, I think, as I have said before, we believe that we hold the correct position with the interpretation of the law, both the letter of the law and the intention of the law, and whether that's CBO's scoring, the comments that we've seen from those who've been a part of it. And so we believe we're in a very strong position in the case. With regard to if there is an adverse decision.
The argument's over, though. Are you ready if there is an adverse decision?
As I have said, if there is an adverse decision, as an administration, we need to look at what will happen, and it's very important to understand the consequences of that decision. There are three things that are consequences. The first is that what will happen in states that do not have a state-based marketplace, if the court decides adversely and says we cannot provide subsidies to those individuals in those states, those subsidies will go away. To give you a sense of the magnitude of that, that is about 6.4 million people in those states. And about 85%, that's the 85%, there are 7.3, but it comes down to 6.4. Those individuals on average receive a subsidy that's around $260 per month. So they lose that subsidy. That means that their premium cost goes up. When that happens, it is probable that they can no longer afford. So increase in uninsured. Impact 2 of this decision, if it is adverse, is that what happens is sometimes referred to as a death spiral. In the individual market, previously prices were extremely high because only the sickest would go in. In a situation now with the marketplace, and I can give you the perfect example, in Charlotte, North Carolina, met the woman who had gotten coverage. Her husband had MS. She was caring for him and they had coverage for him. But in a situation where there weren't tax subsidies, she couldn't afford coverage for her. In a world where she loses her subsidy, what happens is they'll keep coverage for him, not her. Sicker person in the market, premiums drive up. That's that death spiral. The third thing is increase in uncompensated care costs. And what that means in the individual market, but I think everyone also knows when more people are going to the emergency room, what that means for overall cost in the employer base. That's what will happen. With regard to us and our preparedness, the question is, how does one take care of that problem? We will, as I have said, we'll do everything and do our best to be prepared to work with providers, insurers, consumers, and states on the parts that we can do. But as I have said, the critical decisions with regard to whether or not a subsidy will be able to be provided if the court decides adversely against us will sit with governors, states, and the Congress.
Thank you very much.
Thanks.